The word Kaizen, is basically a Japanese philosophy which says talks about continuous improvement. So dentistry continuously evolves, but the point is, are we evolving as dentists? So the concept of Kaizen dental is basically to evolve and keep growing as dentists, become better.
Okay.
You had to do it, okay? When you decide you should go ahead with it,
There's no other option.
there's no other.
The realization that life is finite. You have limited time and करना है तो अभी करो. आपने नहीं किया तो कोई और करेगा. If you have a vision, show it to the world. It may not work, but at least you give it a shot.
Absolutely. Now, if you see, I have not made any reels myself. As an introvert, as of now, comfortable with videos. The day I'll be comfortable maybe with reels, maybe it might happen in a month, it might happen in 2 months.
So we can expect some dancing reels from Dr. Satish.
I am a big Shah Rukh fan. Maybe things like Swadesh inspired me to stay back. This utopian thought you will change something in India. Okay. Amazing batchmates. I had an amazing group. We were called the K Gang. Okay. Don't ask me what K meant.
I can assume Kumar gang right now, but then there must be some secret hidden name also.
Yeah, we weren't very famous. We were infamous. Perio, yes, is not understood so much because in Bds they're not teaching you all these things. They're just teaching you scaling.
Yeah.
So हमारे डिपार्टमेंट में कैसा था? ऐसा लगता था कि पेरियो मतलब म्युनिसिपैलिटी डिपार्टमेंट, जाके सफाई करो. Only thing is you just keep cleaning and scrubbing.
Yeah. Hi everyone, welcome back to a brand new episode of the MADtherapy Sessions Podcast. Our guest for today's episode is Dr. Satish Kumar. Dr. Satish Kumar has completed his MDs in Periodontics and Implant Dentistry. He's the author of 2 books, Bds Launchpad and Dental Launchpad, which are available online. He also runs a successful YouTube channel called Kaizen Dental, where they help dentists succeed in their careers. The audio podcast is available on Spotify and Anchor. The links to that in the description down below. Drop a like if you like this video and consider subscribing if you end up loving it. And also don't forget to comment down below your thoughts on the podcast. Till then, enjoy the episode. So Dr. Satish, what is Kaizen Dental?
The word Kaizen, is basically a Japanese philosophy which says talks about continuous improvement.
Okay.
So dentistry continuously evolves, but the point is, are we evolving as dentists? Okay. So the concept of Kaizen dental is basically to evolve and keep growing as dentists, become better.
Okay.
So that's where the entire Kaizen dental word
But
comes
ये
from.
नाम कहाँ से है? मतलब Kaizen Dental. How did you come up? Like you read in a book, or how did that?
Kaizen
come
is basically a philosophy. All these car manufacturers in Japan, they started with the philosophy that हर बार when you go to your product lines, any fault or problem is seen, वो तभी के तभी rectify होने चाहिए.
अच्छा.
So you're not carrying forward those mistakes.
Okay.
So वो philosophy के basis पे है. So I just picked up a word from Kaizen.
In fact, now Kaizen has become a huge platform where students from all over the world also come for guidance basically. So Kaizen में क्या क्या आता है आपके? मतलब what all comes under Kaizen Dental?
Kaizen dental, basically we started with the help the thing of mind of continuously giving content based on various career options. Okay, that is how we started.
So it was going to be video based right from the start, या मतलब आपने blogs चालू किए थे and then?
No. We started with video. We directly started with YouTube. Okay. I realized there's a lot of dentists ना, हम लोग इतने books पढ़ लेते during BDS that most of them do not read books after that. Okay. When it comes to career development, you read it for fun, you read for growth or something. A lot of people do not read books. I love reading them, but a lot don't. So we started with the concept of a YouTube channel from the start itself. And then we added an Instagram page. Then we have a website where everything is put. Now our aim is to start a dental students community, which is separate for students who are not graduated yet. That'll be on Facebook. So we are starting maybe in the next 3-4 days or something. So Kaizen started as a YouTube channel.
Okay.
And now we're growing it into other aspects as well. That's how.
But why did you feel the need to start it? मतलब ऐसा क्या, मतलब आपने क्या देखा कि आपको लगा कि मुझे ऐसा कुछ प्लेटफॉर्म चालू करना चाहिए जहाँ something like Kaizen, what you envisioned?
Yeah. There are actually 2 aspects to it. First is when I graduated. जब मैं पास हुआ था, I had no idea. मुझे सिर्फ पता था कि you either have to do MDS या clinic. Okay. And I am a person who hedge my bets. तो मैंने क्या किया, पहले clinic डाला,
जी.
फिर MDS भी join किया. So I did both. Okay.
So आपने clinic after BDS you joined a clinic.
No, I started my own clinic.
started
I
your own
worked
clinic.
somewhere else, then I started my own clinic. Then after a year, I did MDS. So I had my MDS and my clinic together.
Okay.
Okay. So मुझे इतना ही पता था ये options है.
हाँ.
But as I was doing it, there were so many options which I was not aware of. Okay. I knew about the abroad options, but in India, for example, Army Dental. I gave my exams at when it was called AIPG. I didn't know about Army Dental. Okay. I didn't know about the non-clinical options. And as I started doing well in my practice, a lot of people, youngsters used to come and ask me कि sir क्या कर सकते हैं, क्या options है, क्या है. And I had no medical background. Okay, I have a family of engineers and teachers.
This was still during your MDS days.
During my MDS days.
Okay.
So I used to get a lot of questions at that point of time. So I thought we should have a platform or a space where everyone can discuss all these opportunities. Not just what after BDS, but even once you put a clinic. How do you go about putting a practice? What are the various options? How do you grow your practice?
Ji.
So I thought everything should be in a common platform where you do not have to go to multiple places. Okay. So I thought of this in MDS, but it took a lot of time to start after that. So maybe we started only 2.5 years ago. Okay.
Just before COVID.
Yes.
So what was मतलब आपको push कहाँ से मिला? What was that final thing कि you decided कि अभी चालू करना है? Like you took so much time, right? कुछ तो एक moment होगा कि आप बोले अभी मुझे चालू करना है.
I don't know. If you see our YouTube channel, no, I had actually started the YouTube channel 1.5 years prior to I actually posted my first video. Okay. So I am an introvert, and to come in front of the video and create videos and post it online was extremely like a tension situation. Whatever you say, you end up thinking कि लोग क्या सोचेंगे. It's a fact of life.
बराबर.
Okay. And being an introvert, you're more scared कि लोग क्या सोचेंगे than just an extrovert.
बराबर.
So the final push was कि अभी 1.5 साल हो गया है. Okay, and the first slot of videos which we uploaded, that was also shot around 8 months prior.
Okay.
Okay. And I spent a lot of time in thinking कि क्या करना है, कैसे करना है, everything. Then finally I was like कि just chuck it, let me do it. Okay. There was no ऐसा exact moment, but we just took the dive in.
You just took the plunge.
Yes.
Like वो. So जब आपने चालू किया, how hard or tough was it to start? I mean, once you started posting videos, what were the difficulties you faced?
See, you're running a podcast of your own self.
Ji.
Okay, so I'm sure you'll know all the difficulties you face. First is coming on camera. Second is, as an introvert, you will also understand this, that when you're shy of camera, facing the camera is the most difficult part. Okay.
So वो barrier आपने कैसे तोड़ा? मतलब like being on camera.
You had to do it. Okay. When you decide you should go ahead with it,
There's no other option.
there's no other option. I had decided कि मुझे करना ही है. Okay. And I had 2 support systems. One, when we started Kaizen, I had a friend called Aniket who was a part of it. And my wife, Dr. Swati. She was an amazing support. Okay.
She's also a dentist, right?
She's also a dentist. So they both were the ones, I don't know, they believed in the idea of Kaizen, but they were like,
They believe
just
in
do
you
it.
basically.
Yeah, they believed in me basically. They told just take the plunge. Before I go ahead, okay, I want to ask you, how did you feel when you started it? This podcast and everything? Because I've realized your setup is amazing, okay?
So
And how did you decide to take the plunge?
something similar. I think we all have some similar stories, but the thing was, especially the pandemic, what I realized is that as human beings, we have a very limited time on this world, and saw a lot of people, not being in this world and passing away. So what I came to this, I had a lot of thoughts and ideas in my head. So I was like, if I don't do it now, I'm never gonna do it. And like you said, I just sat in front of the camera, 2 videos, 3 videos. I think each video made you 1% more bolder to be in front of the camera.
100%. You're
Right now also, it's difficult. I think for you also to be on camera, but then we're much better off than what we were, say, like 1 saal pehle.
Yes.
And I think the realization that life is finite. You have limited time, and करना है तो अभी करो. And अगर आपने नहीं किया तो कोई और करेगा.
Yes.
So if you have a vision, show it to the world. It may not work, but at least you give it a shot.
Absolutely.
And as introverts, I would say, like, we have regretted a lot of decisions जो अपन कर सकते थे.
नहीं किया.
So अभी एक मौका मिला है कि कर ले. तो कर दिए and you have to be consistent at it.
Yes.
It's not कि but like and honestly you are one of the inspirations behind the podcast at being consistent, because I keep seeing up because you put WhatsApp stories also up my status. So every week there was one status from Dr. Satish. So I was like, and especially knowing you personally a few years back also, when you had your own clinic, you were doing so many things. उसके अलावा आप ये कर रहे हो means if he can do it, I mean a good example. आप एक good example हो. So you keep pushing it, and honestly you may not realize, but I may be doing what may inspire someone else also.
100%.
So
100%. That's the whole purpose.
Exactly.
The
So
whole
we have
purpose
to
of
be-
this is that we uplift each other eventually.
बराबर. So we just have to be consistent at it. वैसा.
Yes.
So that was one. Being on front of the camera was one. उसके अलावा any difficulties, any technical difficulties या I don't know.
I am not technical savvy. I'm not like you who has built a computer system of his own. So I had to learn the technical things of it.
जी,
Okay.
जी.
As dentists, we do not know anything about how to run a Zoom meet. Okay. How the camera setups are done, how editing is done. So I'm lucky again. My wife does all the editing part and everything.
Oh wow.
Yeah. So a lot of people do not realize the effort which goes in the back end, okay, of scheduling this, shooting this, editing this, cropping this, putting things like B-rolls. So we had to learn all those nuances which dentists don't know. They're not very tough. I think anyone can master them, but you have to have that willingness to go and learn it. So I won't call it difficulties or problems as such, but things which you need to learn.
So how important was, like, is the role of your wife in, I mean, apart from your life, like especially this Kaizen Dental?
She is, I'll tell you what, the backbone which people do not see. Okay. She doesn't like coming in front of cameras. So I'm like the face of it.
I can give an idea, like, what if you guys both start having a podcast where you both have, like,
She's, I do not like cameras. She hates cameras. Okay. So that's the reason we are
you
not.
can put a camera, I think, कोई कोने में and not in front of her, so she does not realize that camera is on her face.
No, I think you should push your limits. I am all for a believer of getting out of your comfort zone. But then there are certain things you just do not want to do. Okay. Till you're ready, you should not do it. If you have seen this movie, I think it's Shah Rukh Khan and Alia Bhatt. Okay. He talks about climbing a mountain. Okay. You should climb the mountain. Okay. So that you grow. But if you're not just ready, you should not just throw yourself into the mountain. Okay. You have to grow into it. So maybe the day she's ready to come on camera or she's ready to stretch herself to the comfort limit makes sense. Okay. There's this concept of something which should not be extremely impossible to do, but should not be extremely easy. Somewhere in between is where you should stretch, okay, but not break. So that's the philosophy I stick to. Now, if you see, I have not made any reels myself in our Instagram page because as an introvert, I'm as of now comfortable with videos. Okay. The day I'll be comfortable maybe with reels, maybe it might happen in a month, it might happen in 2 months.
So we can expect some dancing videos from Dr. Satish.
Dancing, no, I wouldn't traumatize my audience with dancing videos or something. But someday soon, my next plan is to start with reels or something.
Okay.
But I think you have to be a little bit ready for it. Stretch is important, but it should not be something that you just cannot do and you're just pushing yourself and you do a bad job of it.
Yes.
Yeah, so that's why.
So looking at your background, you did schooling in Dubai
Yeah.
and you came to Mumbai for dentistry. So how did that happen? I mean, why India, and what was the whole thought process?
Understood. The point is, in Dubai, at that point of time, you didn't have good dental schools. Okay. And I was of this mindset, I'll come to India, earn my degree and go back.
Okay.
This was when I was in 12th. And I was a very happy-go-lucky guy. I was not like this career-focused, ki ye karna hai, wo karna hai.
But you were born in Dubai or no?
My mom had come to Bombay for my delivery. So my parents were already in Dubai prior to that. I have an elder brother. So they were there. My dad was there for like 35, 40 years.
Your entire childhood has been in Dubai.
Yes. Till I was in 12th, I was in Dubai out there. So the point was ki you get good further education in India. Okay. So the plan was to come here, study and go back.
Okay.
So that's how I ended up.
That was the plan.
That was the plan.
So what made you stick back? Why didn't you go back to Dubai or any other country?
I am a big Shah Rukh fan. Maybe things like Swadesh inspired me to stay back. I had this utopian thought you will change something in India. Okay. That was one of the initial reasons. Later, I realized I want to do something in my country. Okay. I know it sounds very silly. I have like a lot of videos about abroad after BDS or how to go abroad. But then I thought I want to settle down here and be here. Both me and my wife, after we got married, we went and met counselors to see about whether going abroad is an option or anything. But then we realized we want to stay close to our parents. Okay. Her parents and my parents. So that is when we decided we have a good practice here. We're doing well here. So we didn't want to go abroad. And going to a Middle Eastern country, maybe after 15 years, 20 years, you have to come back. It's not like you can go there, explore. We are not engineers. You can't just jump jobs. So we had a base here. Yeah. Yes. Yeah. We thought we can expand here and make a difference here.
That's very important for a dentist, especially coming from you, because, setting up a base and sticking to it is a huge factor in improving your reach as a dentist.
Yes. And it depends what you want to do in life. Okay. Now, I wanted to be close with my parents. See, at times I have stayed abroad already. So I've spent 17 years. Okay. Around half of my life has already been abroad. So I know the other side how it is. So of course, if you want a better standard of living, it's amazing to go abroad. You'll have better water, better food, better roads, everything. Okay. But I am comfortable here. I am not having a tough life or a bad life here.
Because that was my follow-up question. Are you happy with your decision?
100%. I know friends who are my age group who are still thinking of giving exams, going abroad at this point of time, trying to jump countries.
Same. Yes.
But I don't. There is not even a day I regret my decision. And there are so many things I think I can do in India here.
There's too much potential.
People who tell you there is no scope in dentistry are the people who are wearing black glasses. Okay. Dentistry in India is booming. Okay. 10 years later, 5 years later, 15 years later, it is always going to be there. If you're good, you always will have patience.
But don't you believe you have to find your niche also? Because that's just my thought. Probably you may have differing thoughts, but because I understand we have a huge population, but we have so many dentists coming out, just from example, our New Bombay area, so many dentists coming out, passing out every year. So as a young dentist, coming from you will actually help them, like when you send
No, but I do not agree to the point that you always have to niche down. Okay. This concept of you have to be a specialist in one thing, okay, is not for everyone. Okay. I have created a video about whether you should do MDS or not and whether you should specialize or not. See, some people do not like doing one thing. Now, I have been practicing perio for the last 7 years. I do only perio and implants. Okay. So there's only gum surgeries, implants. That's the only thing I do. I did a root canal in lockdown and it wasn't very great because the patient had severe pain and it was lockdown. I did it. Other than that, I've not touched a root canal for the last 8 years. I have amazing associates who do it. I love sticking to one thing. Okay. I do not like doing one thing in the morning, one thing in the night. But everyone is not like that. It depends on how you're wired. There's some people who can't sit and do root canals the whole day, sit and do extractions the whole day. So if variety is something you want, like you want to do extractions in the morning, implants in the afternoon, composites in the filling, if you like being the super general dentist, there is potential for that also. Okay. So knowing what you want to do a lot of things, you want to stick to one particular niche is something which should come from inside. So niching down is a very good option, but it is not for everyone.
So in short, dentistry will boom in India further.
It is booming. I'll tell you what. 20 years ago, okay, you could only do extractions. How much could you charge? At that point of time, you were charging 150 rupees and everything, 50, 100 rupees. I'm talking like 20, 25 years ago. But only extractions were an option. Yeah. So you were making 50 to 100 rupees per patient, which is maybe in today's equivalent, say around 1000 rupees because inflation and everything. Then came root canals. In root canals, in 2 sittings or 3 sittings, you were charging your patients 2000 at that point of time, saying like 10 years ago, 2000, 1800 anything. Now it's like 4, 5. Okay. So your margins were like 600, 700, 800 per patient. Okay. Now you can do procedures like implants, full mouth rehabs and everything. Okay. So now if you're doing a full mouth rehab, you're charging a patient 3 lakh or 2 lakh or whatever. You're making a lakh or a lakh and a half in 2-3 cases. Okay. So the treatment qualities you're doing have increased. The treatment time to deliver that is the same or lesser. So your margins are increasing. So if I had to make a lakh rupees or a 2 lakh rupees as a profit, say 20 years ago, how many teeth you had to remove? How many patients did you require? And now you can make the same amount in like say 4 patients, 5 patients. Okay.
But you need to be qualified for. I mean, I'm not saying MDS wise. I'm saying even if you're BDS, you need to upgrade yourself and know those things.
Absolutely. Dentistry is about upgrade. Okay. What is being taught in college is 20-year-old thing. Okay. So if you are thinking
That
it is
we
someone
realize-
else's job to teach you,
Ji.
that's not happening. So if you are willing, it's in every field. Okay. My brother, I saw him. Okay. He's an engineer. He works with HDFC and thing. And I saw him studying 3 days ago. Okay. Studying.
Okay.
So when you're in IT also, the IT industry is continuously changing, no? He's into network and all those things, anti-hacking and all. So you have to keep upgrading. So it's not our field.
It's everyone.
Everyone. Technology is shifting the way lifestyle is growing and the knowledge base is increasing. So you have to keep up with times. So if you're keeping up with times, you need lesser patience to make the same amount of money.
Understood. So you did your BDS from Tena College. How was your BDS experience? Overall BDS experience.
It was a roller coaster ride.
Why is that?
As you told, I've done my schooling in Dubai, okay, and I came to Bombay. So Dubai, the population, okay, was very low.
Okay.
So the number of people. So the first day I had to go to college, okay, to Terna. I didn't know there's like a first class and a second class in a train, and I used to stay in Chembur. Okay. So I took a pass of a second class, and I got into the train in Kurla station.
Oh wow.
Okay. And I'm a guy who has never traveled alone in a
With so
local
many
train
people.
ever.
Okay.
So the compartment had so many people, which my entire school had. So I was like smashed into each and every one. And I didn't know where I was. I was like, what is this? How many people are here?
क्या कर दिया मैंने?
And it was a cultural shock. So there was some amount of homesickness. See, today, if you're having homesickness, you can call down your parents, you can contact people. That time it would cost you like 30 rupees to talk for a minute.
Yeah.
Dubai to India, okay? So you can't call your parents. So I used to talk to my parents, say, once a week. And you can't tell them over the phone ki, what the hell, where am I? मैं किधर फंस गया? Okay? And
But did you tell them about this
I didn't
strange
tell
journey?
them. They don't know till down.
Oh.
If they see this podcast, they might know. I've not shared this with a lot of people, but I was suffering from homesickness at that point of time. Okay. And people are different. See, not that they are bad or something, they have different backgrounds of upbringing and everything. And I had a different background.
Yeah.
Okay. So if telling them, it would seem as I was privileged or nepotism or something of that sort. So I never told anyone all these problems I faced. But mentally, I was in a shock. Okay. Of how people are and everything. But I had amazing batchmates. I had an amazing group. We were called the K gang. Okay. Don't ask me what K meant.
I can assume Kumar gang right now, but then there must be some secret hidden name also.
Yeah, we weren't very famous. We were infamous.
It's
So
okay. I'll keep it like that.
Yeah. So, but I had a good time. I had good friends and everything. So eventually I had an amazing time. In retrospect, it was a good time. But there were moments which I was absolutely down and I couldn't share it with a lot of people because my perspective was different from theirs and I knew they wouldn't understand.
So
Because I was India.
what was your perspective? I mean, which was clashing with the
It was not clashing. It's how people behave, how people talk about others,
Achha,
and
okay, like that.
the entire environment. See, when you shift from one place to other, see, you have been in 2 different places. You have a practice in a village kind of an area.
Understood.
You're practicing in Bombay, a posh kind of an area. Your clientels are different.
True.
So you know the mentality of people. Okay, it's not good or bad. It's just they're different. Yeah. So that mind shift adjustment. I know a lot of BDS students जो गांव से आते हैं जो they come and settle in Bombay. Okay, I had friends who had done their BDS somewhere else. They come to Bombay and they just find dressing sense different. Okay, they're like लोग ऐसे कपड़े पहनते हैं. I'm not talking about the caste and thing. अच्छा इतने कम कपड़े. Okay, so for them it is like they have a different variety and I am come from somewhere else and I'm coming downwards. So it is quite different.
Understood. So, any special memory you would want to share from your BDS days? Anyone?
There's no special memory. There are a lot of memories.
Something which comes on top of your mind.
A strange memory, I'll tell you. Okay.
Okay.
There was this freshers event. I was from Dubai. Okay. And we were in the washroom. Okay. There's this guy who was talking about me. So I had reached this round of the top 5. Okay. So he was like, अच्छा वो लड़का जो दुबई का है अच्छा वो नहीं टिकेगा यहाँ पे बहुत साल एक मॉरिशियस के आया था वो तो यहाँ से चला गया उसको तो जमा ही नहीं कितने फेल हुए ओके एंड and I was like, people are judging here. And I'm like, it's not even 4 months I'm into college, 3-4 months.
So he was not.
He was my senior.
Senior. Okay.
Okay. And now I know him. And we are decent friends.
Are you-
He's also a periodontist. And I don't know, he's heard. He doesn't know, maybe I heard this conversation. And I was in a different, I was just.
Have you spoken to him about
Not about this conversation, no. I didn't want anyone to feel awkward. And
now he
he might not even remember.
Okay.
So then I came second. I came the runner-up in Mr. Fresh and everything. And I had a decent college career. So I was like the best student in internship during 4th year. And I was in the committee.
You're always into the, were you into the cultural events and everything?
Yeah, I was a treasurer and we organized
the guy
quite a few
with the
events.
with the less money.
Yeah, the guy who has to always do the jugaad.
So then you came second, right?
In freshers.
Freshers.
Yeah. So, but then I somehow managed in college. So this is some funny stories. Then we had, there are a lot of funny stories. Yeah. Everyone has.
It may not be funny. It's just like, just brightens your day. Like you think about it. I'm like,
Yes.
Yes.
So there are a lot of things we can't talk here.
Okay.
But
next podcast.
Yeah.
We'll talk about that. So you did MDS in perio.
Yes.
So why perio?
As I told you, I put my practice first. Then I did my master's. Okay. So at that point of time, I thought I wanted to do prosto.
Okay.
Then I realized कि prosto में कैसा है dentures है. Okay. And I was very bad with dentures. Okay. My partner in prosto during my BDS, I think she did all the work. Okay. And I was just goof around in the prosto lab. I was decent at the clinical work. But in MDS, you have to do everything yourself. I was interested in prosto. Maybe it was due to the FMRs, the composites and everything. But then MDS focuses on dentures. Okay. That's how the system is based. So I decided not to do prosto. I was interested in surgeries. But I am not that person you can call me at 12 at night and tell me कि trauma हुआ है जाके करो. I am a little chilled back kind of a person. Okay. So I realized maybe oral surgery is also something which I do not want to do. So where I was practicing at that point of time, they started doing a lot of implants. And when I was having cases in my clinic, eventually,
where you were
just before I put my clinic,
Okay.
I was working as an associate.
So that helps, right? Observing, because people say you can decide what masters to take in an internship. I think that was difficult for me also, because once you outside college, once you're outside BDS, when you start working with as an associate and other senior practitioners, and you see certain procedures, and then you're like, oh, I can do this, or I start, you start loving that thing.
Absolutely. That's what I tell. If you see many of my videos or something, that's what I tell them. You should judge based on what you like. Okay. So I realized that I was good at RCs. That I used to do a lot of root canals. I used to do rotary root canals, upper 6, upper 7. The concepts were different at that point of time. We had some concepts like apical puff and everything, which is like.
So you could have been an endodontist also.
What?
You could have been an endodontist.
No, but then at that point of time, my aim was to be a super specialist. I wanted to do everything myself. So the thing I couldn't do is, I was not good at surgeries. I couldn't judge which teeth had to be removed, which teeth have to be saved, full mouth rehabs and implants. So I thought I will do perio. It will add to my rest of the practice. So I can do root canals, I can do crown cuttings, I can do extractions. So I add these skills and I'll do everything myself. So at that point of time, I wanted to be a super generalist, as in I wanted to do everything myself. That shift happened when I got into MDS. So getting into perio was basically something which I didn't know much, and I wanted to add to my armamentarium. And I realized that a lot of procedures depend upon how your perio is. So that's why I took perio.
So during your MDS days, what was your favorite perio procedure?
MDS days, I don't know, but generally I like doing a lot of grafting soft tissues, basically CTGs, FGGs.
Any particular reason why? Do you have a reason why?
Yeah, it is more technical, skilled. Implants is also tough, but it's something which changes the architecture and how you look. I don't know if you've seen Friends, In Friends, there's this twin of Ross, not twin of Ross, it's someone who looks alike of Ross, comes in the picture and he's there. So he is a MDS in perio. So Ross tells him this dialogue, ki you have done super specialization in the tiniest tissue of the entire body. But that's where the skill is.
Yeah.
It's funny also, but it's the tiniest thing and you need a lot of skill handling it. So
people don't give periodontists enough credit as to what they do, because like you said, it's one of the tiniest tissues and it was a lot of skill. Any minor right or left, and I mean the prognosis can go for a toss.
it's good a lot of people don't give periodontists a lot of this. So it's a hidden branch. People don't realize you're sitting on a gold mine. Okay. For example, your success of implants, your success of full mouth rehabs, they depend upon small things like how much bone you have, how much attached gingiva you have.
True.
So perio, yes, is not understood so much because in BDS they're not teaching you all these things. They're just teaching you scaling.
Yeah.
So हमारे डिपार्टमेंट में कैसा था? ऐसा लगता था कि पेरियो मतलब म्युनिसिपैलिटी डिपार्टमेंट, जाके सफाई करो. Okay. The only thing is you just keep cleaning and scrubbing.
Yeah.
So if people are taught the importance, they will love it. And eventually when you have your practice, and you do a lot of implants and everything, you automatically start realizing the importance. So you don't have to go and tell them.
So now when you were doing MDS, what was the main difference जो आपको लगा कि अच्छा ये मतलब okay, BDS से कुछ अलग है ये, like when like anything main आपको से लगा कुछ?
You're focusing on one thing. Okay. There are two shifts. What happens? One is तुम एक ही चीज पढ़ रहे हो बहुत टाइम के लिए.
जी.
And second is you are more mature. See, when you're doing dentistry, you're say 18, 19 till 21, 22, 23 max. So वो maturity नहीं है. So you're just studying to finish.
Yeah.
When you're doing masters, there is a shift in your mindset also that you are becoming more serious कि मुझे अच्छे से करना है. Okay. Plus there is this focus towards one particular thing. So how I wanted to be a generalist at that point of time, as I got into masters, there was a shift in my mindset कि I love doing this and I want to specialize. So it's basically the mindset shift and
of mindset,
yes,
yeah.
which happens when you're doing MDS.
So you did MDS in BVP, Bharatiya Vidyapeeth. How, I mean, if you could just summarize into a few lines as to how was that experience?
This is, I think it would be called survival of the fittest or just survival basically.
ऐसा क्यों बोल?
We were the first batch. A lot of
the first MDS batch.
First MDS batch in Perio.
Oh, wow.
So they were also learning. We were also learning. But they were very supportive that way. They were experimenting a lot. So we were the ones who came up with the initial pro forma of how to go about taking the checklist of everything. So how the thesis is done, the LD is done. Everything was new to them and to us.
जी.
So there was a lot of learning curve. It was a steep learning curve because you didn't have any seniors who will tell you कि ऐसा करो वैसा करो. So I think it was just a learning curve का experience major.
So आज जो भारतीय विद्यापीठ में हो रहा है पेरो डिपार्टमेंट में,
It's very smooth.
No, so you are a part of it. You're part of the history as to जो हो रहा है वो शायद से आपकी वजह से ऐसा हो रहा है. Certain things.
No, that's taking a lot of credit. But certain things, yes.
You are a part of it. History.
Yes, we are part of it, and right now it's very smooth compared to the initial. See, whenever you start something new, there is always hiccups.
बराबर.
So we were part of the hiccups.
Also, you are into teaching. You conduct clinical courses. You also teach indirectly on your podcast. So, like, why teaching? Are you passionate about it, or what? Like,
I wouldn't call the word teaching. Okay, I never thought I'll become a teacher, to be honest.
Okay, but you have become one.
No, it's about just sharing what you know. Okay. I don't know, a lot of people in this podcast do not know. He was one of the students when I used to teach clinical perio.
I learned CLP.
Yeah, so I don't know how it was. You should tell how good a teacher I am or something. He will tell you in private.
I'll make a dedicated video in the start explaining that.
Okay.
So are you always into it, or like are you like, because there are people super passionate कि मुझे सिखाना है लोगों को, like I want to impart knowledge, like what I learned. Like,
no, I am not that kind of a person कि मैं अपना knowledge दूसरों को ठोकूं. There's this dialogue, okay, जो कर नहीं सकते वो सिखाते हैं. So I am in that bracket. I just like, I've tried something, it worked, it didn't work. I just like sharing. That's the whole concept about teaching. It's not like I'm an expert, you should learn this, this is the way you go about it. I am not that kind of a person. I don't think mentally think I'm perfect or I'm a specialist or the best in it. It's just कि मैं ऐसे करता हूँ. Can try it, work for you maybe. That kind of I prefer.
So because you have been teaching since the last few years, what's the main difference? What you have seen कि जो बच्चे जो BDS तभी आप for example आपके टाइम पे आप BDS कर रहे थे, आजकल के जो बच्चे जो BDS करे, what's the main difference you see between
them? They are more intelligent. I'll tell you what, they are more exposed to the world. When we started, अपना exposure इतना नहीं था. See,
जी.
today everything is on YouTube. How I told you, when I graduated, I didn't know the options. Now, when we run Kaizen, I get Instagram posts from students who are in first year.
जी.
And they're already thinking कि ये करूँ, वो करूँ, abroad जाऊँ. They are more exposed to all these things. And a lot of them are capitalizing on it. So it's a very nice thing that they're making use of technology and use of the knowledge around there. So that shift is there. We were a little more dumb maybe.
Any bad thing you think which today's generation can improve on?
Let me think. They want everything right now. Why dentistry has a bad name? Okay, clinical dentistry.
Yeah.
Is they think आज मैं निकला ना, कल मुझे 50,000 60,000 की पगार मिलनी चाहिए. Okay, they are not realizing dentistry is an art form. Okay, the person who's painting the road does not get what MF Hussain was getting paid. Okay,
Barabar.
you have to become from a road painter to an MF Hussain.
You have to improve, exactly.
Yes, and eventually you will get, there's a lot of money. They compare it with the other fields like engineers and everything. उसमें कैसा है, तुमको बिठाया, तुमको सिर्फ काम सिखा रहे हैं, तुम, it's like a mechanical work. I'm not criticizing engineers or something, but there is a lot of mechanics in it.
वो देखा देखी हो जाती है ना, like अपने age के, you're 23 and you're, like, you know, at that age engineers
Yes, so that's my whole point. So the thing I think is,
have patience basically.
yes, the bad thing about them is they're impatient. उनको अभी चाहिए, सब चाहिए. Dentistry takes 10 years to grow. So they have to be willing to put in those hours. This is the bad thing. Patience is lacking. Because you get 10 minutes में Swiggy. 1 second में online the app opens. App does not open in 1 second, you're frustrated.
So anyone in today's generation, if they just have patience, they're gonna become great.
If you have patience and continuous perseverance towards that, you will 100% achieve success. Whichever field. 100%.
So, for example, Kaizen Pay, you have interviewed a lot of doctors and a lot of people from very niche branches also. So what was that one branch which has fascinated you? Because
as in what if I would do?
No, for example, you may have interviewed prosthodontists, periodontists, oral surgeons, but there are now more fields coming up in dentistry. May not be master's level ke, but then they're very niche. Like you have sports dentistry, you have forensic odontology, you have people do MBA. I mean, you have practically made videos with everyone.
Understood.
So what is that one branch जो आपको लगता है कि like that fascinated you? अच्छा ऐसा भी होता है या like it seemed interesting to you?
Interesting, a lot of things. Okay. Now, for example, I interviewed someone who's doing medical coding in US. Okay.
Medical coding
in US. Okay, it's not just transcription and everything. They create programs and everything of those sorts.
जी.
So in non-clinical, that's an amazing option. Then in clinical, there are various niches like sports dentistry. A lot of focus was not given. Okay, sleep dentistry.
जी.
Okay, which is like a sibling of it. Then full mouth rehabilitations. So dentistry has potentials in lot of niches. There's not one particular field I can actually pinpoint. But I am fascinated with how dentistry has evolved in different niches basically. So I think it's each one should pick a choice based on their own.
Also, you have 2 books on Amazon. Bds Launchpad. So can you share something about it? Like how did you start, like even think about writing book, writing book, because that takes a lot of efforts. काफी कुछ scripting में जाता है. It has to be original content. You cannot copyright.
Understood.
So how, and in your tight schedule, you have managed to release 2 books on Amazon. They're both selling very well. Lot of positive reviews. How did you manage that?
The first book is known as Bds Launchpad. Okay,
Ji.
that is focused towards students in dental college.
Ji.
Okay, how I told you the problems I faced. I had homesickness. Okay, I didn't know how to go at studying. Then should you start studying NEET के लिए पहले से ही?
जी.
तो ये सब चीजें I was not aware of. मुझे idea नहीं था. So it's basically a pathway. If you're a BDS student, it's like a quick read. Okay.
जी.
कि हाउ डू यू मैनेज योर टाइम, बाकी सब चीज़ें कैसे मैनेज करने का, सीनियर्स के साथ कैसे बिहेव करने का. सो इट्स अ वेरी क्विक रीड of tips and tricks you can use during your BDS college.
So that is Bds Launchpad.
BDS Launchpad.
And then Dental Launchpad?
Dental Launchpad is for people who are just graduated from BDS or they're like say interns or in 4th year.
Okay.
So that is in a story format. Okay. So they're like these 5 friends or 6 friends and they are confused क्या करे life में. Okay. So I didn't want to tell you. It's like telling Arib, तू ये कर, you will be successful. but I do not know what your background is. I do not know what your interest is. Okay.
So you created that story.
Yes, there's a story. So they meet a mentor. Okay.
So you are a storyteller also now. that's another feather. That's a great thing. I mean, that's another feather in your cap. But like, how did you like that story was playing in your mind for a long time, and then you managed to write a book on it?
Yes, the whole concept is we have discussed various issues. Like, should you do MDS or not? MDS college kaise select karna hai? Should you get into non-clinical or clinical? How do you convince your parents to get into non-clinical or something? So what happened is the various problems people face. Okay. So we have made different characters who are going through different cycles of their journey. Okay. So like 6 friends. One is thinking about whether he should do MDS. One is thinking of whether should I put a clinic. How do I find a job and associate? Kaun se courses karu? Kaise karu? Okay. So these 6 friends who are having different dilemmas. When you go abroad, how to think about it? What are the problems you might face on going abroad? So they discuss, it's basically interactions between these 6 with their mentor. So you get a different perspective. So you have to select un 6 mein se which you suit. Yes. And select your journey. So Dental Launchpad is more about understanding your journey after BDS. So I think someone who is confused about what after BDS, it's a good pick if you like reading.
It's amazing. Like, just reading through a book, you're indirectly helping them out. Like,
yes.
Sort of like a self-help book, but for dentistry.
Exactly.
So, that's a personal question. What advice would you like to give young students and young clinicians regarding dentistry in times like today? Especially, we had a pandemic where dentists were the most affected batch in healthcare. We had to shut down our practice for some time, and then any advice from your side for...
So you're talking for dental students, people who are pursuing dentistry?
And just people who have just put their clinics. So young clinicians and people who are still doing dentistry. Any advice for them?
I think the advice would be know yourself. Okay. The most common question I get asked, like how you asked me, is what is the best niche? What is the best thing? Okay. There is nothing which is the best. Okay. Now if I tell you, which is your favorite color? It might be black for you, it might be blue for me, it might be green for someone else. A lot of people are looking for answers outside. Okay. So the ideal thing of how you want to chart your career, if you're a dental student or you're just started your practice or something, is look inside. Whether you want to niche down, like how you asked me, whether you want to be a super generalist, okay, you have to spend time with yourself. Rather than asking questions. Yes, you should know all the options which are available out there. Okay. All the discussions and all the possibilities out there. But finally look within. Now, if I want to know you, if I want to know Arib, I'll tell you, chal, we'll go for a coffee. I'll come to know you more. How many people actually spend time knowing themselves? Okay.
True.
They think ki usne wo path liya, wo mere liye theek hoga. Okay. It is not the same. So, my advice to all the young dentists is know yourself and what suits you. आपको क्या सूट होता है? मतलब आपको क्या चाहिए लाइफ से? It's not मुझे क्या चाहिए, Dr. Satish को क्या चाहिए. Now, I didn't want to go abroad after my BDS, but there are so many people who want a standard of living, aram life, and work 5 days a week. Maybe abroad is an option for them. So, know yourself is, I think, people need to focus more on.
Okay. That's very good advice coming from a person who gives such sort of advice. And you deal with a lot of people because I won't say you are bored, but you may be not frustrated also because so many people ask you the very same question. Kya karu? But what you said was absolutely true. You have to know yourself to know what you can do. Because in the end, you have to live with yourself. So
exactly. I want to know do you spend time on knowing yourself? How often do you do it?
You have to do it.
So how often do you do it? Do you have any method you follow?
Meditation, going for a walk.
Okay.
Listening to music. I think sometimes even gaming helps.
Because you're in that flow state. You're right.
Yeah, and like I said, told you today morning, because I play some video games in the morning, I know I've had that fun part. So now the rest of the day I have to work hard because khel kud ho gaya. Now rest of the day, make sure that you compensate for that.
Understood.
So like you said, like not everyone is into gaming now. People as they grow up, probably because people still ask me, "Are you still play video game?" I said, yeah, that's a part of me. Of course, I don't play like for hours, but then wo ek lagta hai ki if I don't play some video games.
Yes, it's like I tell you what, it's like having cheat food.
Ji.
Okay.
Ji.
If you have sad food your entire life, okay, you'll have a long life.
Yeah.
But why did you live it? So you should know what to have. Sometimes you can have unhealthy, but you should know where to draw the line. You can't be having just enjoying life.
True.
So knowing yourself कि तुम्हारा line किधर है, तुमको कितने मजे मारने हैं, कितना career growth करना है. So you have to focus both on how much you want to grow your career, but how much you want to sacrifice your normal life to grow your career.
Fair enough. I mean, you couldn't you have summed it up very well. So we'll come up to our last section, which is a new section called rapid fire questions.
Okay.
So I'm gonna ask
what does this do?
So I'm gonna ask you some few questions regarding dentistry and maybe without. So we'll start with that.
Okay.
So your favorite restaurant?
There's nothing specific, to be honest.
Anyone which you would not mind going?
There are a lot, yeah. Shit. This is the first one. I'm not a very big foodie, to be honest. There's smoking pizza in where I stay, Koperkene.
Okay.
So I love pizzas. So they have a cheese burst, which is actually a lot of cheese burst in it. So I love cheese, I love pizza. So I think maybe I'll stick to that.
Great answer. Schooling in Dubai or dentistry in India?
Everyone loves their childhood. Schooling in Dubai. I would kill to be back to school.
Favorite dental instrument?
Favorite dental instrument? There are two.
Okay.
One is lasers.
Lasers?
The reason is it is bloodless. It's better for the dentist. Okay. It is equally good for the patient, but the dentist, it's more clean. Okay. As a dentist.
Yeah.
Second is this one. It's a type of drills for implants. It's called as Densa. Okay. It's made a lot of implant procedures easy for me. Okay. So these are the two things I do basically, implants and perio. So I think I would stick to Densa and that.
Okay. If not a dentist, what would you be?
Everything under the sun. When I and my wife talk, I don't know. Maybe an engineer working or entrepreneur. I would do some business.
Okay. Favorite movie?
Kal Ho Na Ho. I'm a Shah Rukh fan and a Deepika fan.
Any one YouTube channel you would recommend people to watch, apart from mine, but...
Yeah, yours is amazing. I've seen a lot of podcasts, to be honest, of yours.
No, any one YouTube channel which you would recommend people to watch. I mean, your personal favorite, you want people to go and watch that channel.
There are a lot.
Anyone?
I think Beer Biceps by Ranveer Ahluwalia is one, which I follow quite a lot.
Okay.
Then I randomly watch. I'm a YouTube junkie. Okay. So there are a lot of motivational channels. I'll watch video influencers. They are about video if you're doing a YouTube channel or something for that. Then I think these two maybe.
Okay. Describe marriage in one word.
Partnership of equals. So it's about adjusting. Adjustment and partnership is the word.
Like one word.
Partnership.
Okay. Practicing dentistry as a clinician or teaching dentistry to students?
You can't split it. If you're only teaching and you're not practicing, eventually you'll wear out. Because then you'll have to be teaching something like NEET, only theory. But if you're teaching clinical, I don't teach theory. I don't teach NEET. I don't teach all that. Because I've got offers for it. I've got one day for yesterday also to teach NEET and everything theory. I don't do that.
Okay.
So clinical dentistry, teaching without clinical dentistry is, if you're teaching clinical, is bullshit.
Okay. Last question. How does Dr. Satish unwind, relax and chill? What do you do apart from dentistry and writing books and doing podcasts? What do you do in your little free time?
I watch a lot of YouTube videos. Okay. I read a lot. I listen to audiobooks also. I listen to music. I watch a lot of sitcoms. Right now I'm watching Modern Family.
Okay.
I watch a lot of movies. I like in-depth. I'm an introvert. So I love in-depth conversations like this. Okay. So I can sit and speak and listen for an hour and a half. It can be anything under the sun. It can be philosophy. It can be business. It can be politics.
Any podcast you're listening to currently, or any audiobooks you would recommend people to go?
Audiobooks I listen. I'm literally listening to 4-5 right now. Okay, simultaneously. So there's like Dare to Lead. There's Bold. But I think you should not ask someone else for what they want to listen. You should listen something to at what point of your journey. So now, for example, Rich Dad Poor Dad, okay, is a book which I loved. If I read it now, I might not enjoy. But I read it at the start of my career to know how business works, how money works. If you're not from a business family, you should read that book. Okay. Then if you're looking for something more philosophical, you should listen to like The Power of Now. Okay. So it depends on what phase you are. The book suits you. So you might like the book at one point of time and might not like it later. It's something like that.
Thank you, Dr. Satish, for having taking out your valuable time for this podcast. It was invaluable because we got to learn a lot from you. So if anyone wants to contact you, I will be linking all your links in the description down below, but what would be your preferential mode of contact?
I think Instagram DMs. Okay. When I started Instagram, I never liked Instagram. Okay. But I realized that DMs are very easy to use.
Okay.
So it's like a WhatsApp online. I think Instagram DMs at Kaizen Dental is where I am easy to reach and I can contact them or respond.
And before we leave you, what's your next step for your YouTube channel? What's next for Kaizen Dental?
I want to grow it.
What are the upcoming projects?
Yes, I want to basically grow it. I want to grow it to be a community.
Okay.
So I'm actually looking for a lot of people who would be willing to join and who have the same vision. The vision of Kaizen Dental is helping dentists succeed. So anything which comes under helping grow dentistry per se. So I've not got a lot of like-minded people, to be honest. There are not people who are willing to spend time, effort. They want to grow. They're good intentioned. So we are now starting a community for dental students per se in the Facebook group.
Okay.
And I want to eventually start communities. It's not that Dr. Satish comes and gives advice, do this, do that. It's like each one tells from their experiences. So even I can learn eventually that what problems you had. See, like when I came here for your interview, I've learned a lot of things of how you do a podcast. You put in a lot of effort. Okay. To be honest, the effort you have put into your setup is like, I might have put 10% of it. Okay. So when you learn from others is something which I want to do personally as well. So I want Kaizen Dental to shift into a community rather than just content.
I think that's the best part about the YouTube community also, because everyone is so helpful.
Yes, absolutely.
And it's something what I've not seen in other communities.
I want that to happen in dentistry.
True.
So you ask me what I want next in dentistry is I want dentistry to be from these silos where you just work in your clinic. मैं जाके पढ़ता हूँ, अच्छा उसको नहीं दिखाता हूँ, वो patient मेरा है. To be a more open, resource-minded thing. And I've realized the more we grow together, the whole field will eventually grow. It's just, you have to increase the size of the pie. You just can't keep cutting the same pie. Ki main kha loon. Can't do that.
Wonderful. Thank you, Dr. Satish, for taking out your time. And it was lovely having you on this podcast. We'll again meet and again
100%.
We'll have a little more in depth and hopefully know a little more of your secrets which you could not share this time.
So, I loved being in your podcast and I love your setup and the effort you put in. It's one of the podcasts which you asked me about podcasts. I've seen a lot of your videos. Out of your 70, maybe I've seen at least 50 of them.
Thank you so much. It was great having you. We'll hopefully see you again soon. Thank you.
Yeah, thanks a lot.
Thank you. Done, sir.
I hope you don't have a lot of edits.
No, none. It's going to be a one thing.
तुझे कितने बार कितना edit करना पड़ता है? How much time do you spend?
Couple of hours.
Okay.